When we're working the fascia, we have to be a little bit more patient, give the fascia a chance to release. So we're usually working anywhere between 30 seconds to 90 seconds. Now, whenever pain feels a bit more nerve-like, if it's too sharp of a pain, you want to be careful because you don't want to stay on that too long and actually cause a damage to the nerve. So you want to work in increments of maybe 20-30 seconds and work your way up to 90 seconds. We don't want to try and start off with 90 seconds because we could be blocking off that nerve and causing damage to it or irritating it more. With the massage gun in the off position, we're going to start with the psoas again. Remember, we always want to try to work our way around so we don't miss some things in the low back or the hips. When we're working on the low back, we want to make sure that we take care of the psoas and the hips. Here's your midline, here's the side of your body, about halfway. That's where you want to place the ball and work with the pipe and ball or the massage gun in the off position. Let's start off either high or low, but we're going to work our way up and down between the pubic bone and the ribs. So I'm going to start my way up high. Now I'm going to push and then extend my leg out. When you are gliding your leg down, try to make sure you're avoiding any kind of rippy kind of feel. So especially as you get higher up into the higher fibers, it can feel like it's almost ripping. Back off on this pressure. You don't want to tear any fibers, so you're trying to work within your parameters. If as you go in and you go, ooh, that's feeling really rippy, back off a little bit. Still keep slight pressure on there, but don't put as much pressure. When I bring my leg back up, I'll release the pressure and I'll push again and extend the leg. And just do that a few times as I walk down this all the way down to the pretty much where the inguinal ligament is actually, not the pubic bone. So do about 3 or 4 passes in each of these spots until you reach way down here by the inguinal ligament. If you find that the ball of the massage gun is too small and doesn't really dig in here as well as you'd like it to, if you grab a lacrosse ball or even a softball, placed at the end of a 2-inch diameter pipe, you place it right there and you put that in to your stomach area, you can actually now pull down and create the same effect as with the massage ball, gun ball, and you can push down and extend that leg. Remember that when you bring it back up, you release the pressure. You don't want to push as you're pulling it back up yet. Then we turn the massage gun on high, and now we're going to work our way around the hip and into the low back. So the hip, remember, we were working on the TFL muscle, which is if you place your hand here, you're going to find that right in front of your knuckles. So you're going to be working on this. Now, this time, because we're working on the fascia, we need to make sure that we spend a good amount of time in trying to just work with those fibers. The fibers run up and down, so we're going to work the massage gun up and down for a good almost a minute. We can go up to 90 seconds just like that. Now be very careful if this becomes to feel more nerve-like. You want to make sure that you don't go past that 30 seconds too much, because you could end up irritating the nerve. And now I'm working my way around the hips, so I'm going on the side now. This is the glute medius and minimus right in here. I'm going in between the hip bone all the way down to the greater trochanter here. And I'm just going up and down. Stay as relaxed as you can in that muscle. You can go upwards better than you can downwards sometimes, so it's easier to just do that. And as I hook upwards, I can feel there's a spot right in there that's pretty tender. So I want to make sure I get up in there and I release that. Then you work your way into the glutes. So now I'm working with these fibers of the glute max, and the glute max fibers run more like that, this way. Stay nice and relaxed in the glutes and go back and forth, just like that. I'm going to work the fibers to elongate them. If I want to get into the piriformis, lean back a little bit, that'll soften up the glutes a little bit, and then you can get in a little deeper. Just like that. Now you're going to work your way onto the sacrum here. Sacrum sits like right there. Okay, you're going to feel the bone right here. It sits right there. You're going to work on this sacrum and go upwards along the spine here. But be careful, if you place your hand on the low back just above remember the PSISs sit right here. If you place your hand here, just above your hand, this is where the kidneys sit. Now, if I go too far out, I'm going to be punching those kidneys too much. As long as I'm here next to the spine, I'm a little more protected by the spine, so it's not going to be hitting the kidneys. So you got to be very careful when you're doing that. You're going to be working your way along the spine here, just like that. Stay close to the spine. You can even, if you want, use the fork to get in even closer to the spine here. But you're going to be working these muscles up and down just like that. What you can do to get into the QL, obviously, you can get in here, be more on the side. Remember, we can find it by placing the knuckles on the spine, the big knuckles on the spine. Extend the hand out where the middle finger lands. That's where we can actually get in and get into that QL muscle, right between the ribs and the hip. So we can get into that. What you'll notice is that your hand is going to get tired, or your arm is going to get tired. So what I recommend is getting out the PVC pipes, or perhaps even a broomstick. This is about the size of a broomstick. It's a 1-inch diameter, 2 feet in length. What you're going to do is you're going to place it right here on a slight diagonal. So that makes sure you're just below the last rib and above the hip when you're doing that. You're going into the soft part in between the hip and the ribs. So where the QL is. Remember, you can find it by placing your hand here, and where the middle finger lands, that's where this guy's going to be as well. When you place the pipe here, you can angle it slightly differently, whether you go more this way, more this way, but do not go flat like this. You don't want to be across the spine. So don't go straight across the spine like this. You want to be at a nice diagonal. You will achieve that just by placing your hand or your arm up into like almost a 90-degree angle here. You lift up and then place your body down onto the pipe, and you will get a nice diagonal angle on that, right next to the spine. It's going to release the QL area, the erector muscles, and all you have to do is rest. This is resting here. I'm not having to hold anything. And then you can play around with the leg just like this. Arching your back a little bit down like this. You can place your leg up here and let it rest. You can also play around with it by letting it go out more. By doing this, you're changing the angle on that pressure. And all you have to do is just rest on it. You don't have to keep moving your arm around. You don't have to do much aside from lying down. So I find this to be more relaxing, and you can get into those muscles without having to work as hard. And you're waiting for, 30 to 90 seconds in this spot. As long as it's not it's not, as long as it's not irritating the nerve. So if it's a sharp pain, maybe don't go quite 90 seconds. Work your way up to that 90 seconds in increments of 20-30 seconds. Now with this 2-inch diameter pipe, you're going to work on the hips. You place it perpendicular to your body. You're going to find the greater trochanter in your hip and place that right in between those. So now you're going after the TFL, the glute medius and minimus, and all you got to do is rotate towards it or rotate away until you find, whoa, there's a good spot. Now when you find a good spot that's tender, wait. You got to give yourself that 90 seconds if you can. So as you're on here, you can also bend your knee a little bit. If you bend the bottom leg a little bit, you'll notice as you rotate, you get into that TFL a little bit more, and you can get into a good amount of pressure in that, because your body weight will take care of it. You don't have to do the work. So that can take care of the hips right there. As you rotate back more, you can get into the big glutes, the glute maximus. And if you come up a little bit, bend your knee just like that, you're now getting onto the piriformis. And the external rotators, a little bit of the internal rotators right there. And you can roll just like that. Nice and easy, slow. This is fascial work, so we're not needing to go fast. And we have to be careful when if it's too painful. If you can't lie on that spot our job is to find tender spots. But if we can't sit on them for 30 seconds to 90 seconds, then we need to find a different angle that we can attack it from. Because if you can't sit on it for even 10 seconds, while that's an important spot, your body's not going to allow the change to happen. You need to be able to sit into it and relax, breathe through it so that the fascia can let go. After working on your low back, you want to make sure that you also check out the stretches under the stretches page. You might need to check into maybe the all back or all day sitting, all day standing. You definitely want to introduce a little bit of low back torque unless you have a bulged disc or herniated disc. And if so, then you have to make sure you follow the protocol for a bulged disc, which is under the same page. Aloha for now.